Welcome, everyone. We're just giving a minute for people to join. So, good morning, good afternoon, good evening, everyone. Welcome to all of you. A very warm welcome, and particularly to those of you who are, if it's late at night or early in the morning. Thank you so much for joining. Today's EPI-WIN webinar is on the introduction to the WHO outbreak toolkit and applications. And we hope you'll find it very useful and use it extensively after this webinar. For those of you who are unfamiliar with EPI-WIN, it stands for the WHO Information Network for Epidemics. And what we try to do is make scientific knowledge and um, evidence accessible, understandable, relatable, and share knowledge and experience so that you can have evidence informed actions and policies for health emergencies. So, some housekeeping here. Today, this webinar is being recorded. Um, we will then share the recording on our website. We'll try and get it up as soon as possible, along with the presentations. Uh, But also, I'd like to invite all of you, and I can see that you come from different parts of the world. We'd love it if you introduce yourself in the chat and where you come from. And if you have experiences, insights that you want to share on the chat with everybody, please do so. This is an experience sharing situation. Please, however, put your questions in the Q&A box, not on the chat, because we may miss it if it's on the chat, but please put it in the Q&A box, and we have an eminent list of panelists who will respond to your questions. Please, however, keep all your questions and comments respectful and to the topic. This is a learning experience, a sharing experience where we all help each other so that we can prepare better for health emergencies. Uh, let's keep it all positive for everyone. Now, without further ado, then I'll just go. Let me introduce the agenda. Uh, the first speaker is Dr. Leshan Koi, who will present the WHO Outbreak Toolkit. And then after he presents it, you get to know in practical terms how to use the WHO Toolkit. And Bernadette Mirambe will talk to you through that. Then we have Aspen Hammond from the Global Influenza Program talking about the case for joint outbreak investigation using avian influenza outbreaks. And we have Ong An Prasan Panik, who we know better as AIM, and she will be talking about response preparedness program for zoonotic disease outbreaks. Uh, Moderating all this is the project lead, Marie-Amélie Digale. And I will hand it over to her very soon. But before that, let us hear from you. So you know this, you're familiar with this already. We are going to have a Slido. And the first, so please join us at slido.com, hashtag 3046766. That's hashtag 3046766. It's also in the chat. And the first question is, we'd like to know more about you. Have you ever been involved in an outbreak investigation or response? Okay. Yes, the majority of you so far, but that's only 20, 30 participants. We'd like to hear from more of you. Come on. A better response would help us understand you better. There's 67 responses, 71, and there are many more of you out there, so please. Yeah, but it does look like the vast majority of you have indeed um, been involved in outbreak response. Fantastic. So this will be helpful for you. Now we go to our second question. What's your current role in outbreak preparedness and response? Is it field epidemiologist? Okay, there's uh, other partner. Okay, so field epidemiologist, other partner organization, health emergency manager, lab professional. Okay, so that's good to know. The majority of you, well, not the majority, but a large number of you uh, is are from other, except for the versions given. But the next biggest group is field epidemiologists. So great. So this will be useful for you, I hope, when you learn how to use the outbreak toolkit if you're not a direct epidemiologist or in the surveillance area. So in the interest of time, I will stop here. We have two more questions at the end after the webinar. We'll see how whether your perceptions change by then. But for now, we move on to the technical part of it. And for that, I hand over to Marie-Emily Degal, project lead. Marie-Emily, the floor is yours.
Thank you so much, Supriya, and thank you to the EPI-WIN team for hosting us again for this outbreak toolkit. I'm always very in awe of the audience that the EPI-WIN attracts, and I really appreciate the opportunity for our team and colleagues to present today. So with no further ado, I'll let Lishan Koye, who is a field epidemiologist who has been working on the outbreak toolkit for a very long while and who actually has used the outbreak toolkit when he was an FETP and a field epidemiologist in Kenya, present what the WHO outbreak toolkit is. Over to you, Lishan.
Thank you so much, Marie-Emily. So as you share the screen, I just want to say welcome everyone, colleagues, for joining this webinar and for making time to join this webinar. Today, we're very happy and pleased to introduce to you the outbreak, the WHO outbreak toolkit, which we love calling the one-stop shop for most of existing WHO guidance and outbreak investigation tools. Marie-Emily, I can see the screen yet. Thank you very much. So we like calling it the one-stop shop because this is where we've managed to put together all our resources for outbreak investigations. And I'll also like to just acknowledge the team that has been working on this, which is myself, Stacey Dunkel, and Marie-Emily Degail, and of course, appreciating other colleagues who worked on this before. And next slide, please. So the outbreak toolkit, the idea came from the lessons learned from the Ebola outbreaks in West Africa between the year 2013 and 2017, where we had delays in the initial field investigations of these particular outbreaks, mostly because there was a lot of time needed to put together all the resources that were needed for a response. And even when the data began and the response began also, we were receiving quite low quality data or data that never met the required quality standards. And data was also collected for quite extended periods of time, mostly because you forget about some information that is critical for the response of the outbreak or for identifying what outbreak is going on and the patterns and the transmissions and so on. and still the data had no clear standards. And even the amount of data that was also collected, for most of the time, it was also never analyzed. And at the same time, WHO guidance documents, which are really the standards for a good practice outside there in the field, were also spread and scattered quite across many different web pages and other repositories, making it very difficult to find the exact materials that you need for the response and for outbreak investigation. And we all know, as people who also practice in the field quite a lot in investigating outbreaks, that the quality of the response really depends heavily on good early analysis of the data. And this good analysis requires reliable data that is collected from the start of the outbreak. Next. So even in recent missions, we continue observing that we still experience the same challenges that limit our actions and decision-making on during these outbreak investigations. We still have a lot of time lost in gathering and adapting some of these technical resources provided by WHO. And we still have a lot of extensive data collected, but poorly formatted, data that is not comparable across different geographies or different outbreaks. And consequently, we have a lot of poor linkage of epidemiological data, clinical data, and even laboratory data. And we also have limited tools that guide during investigations of outbreak of unknown origin. Next. So the overarching goal of the outbreak toolkit is to limit the impact of outbreaks by mostly improving the quality of the data that is collected, also improving the timeliness of the outbreak response, and the use of that data collected during investigations by mostly helping us to show us how to collect it, how to analyze the data in the earliest hours possible. And this therefore strengthens our ability to respond effectively. And ultimately, it's to limit mortality and morbidity and socioeconomic impact of the outbreaks by supporting the rapid identification of what is causing that outbreak or with a particular outbreak that is going on, and any other public event, including those of unknown origin. Next. So our approach has been to come up with a repository, like I mentioned before, a one-stop shop of all the WHO resources for outbreak investigations and response, organized by each particular disease and also kept updated regularly. And so we've managed to come up with a set of also generic outbreak investigation packages. The famous ones or the common ones that we have are the T0 and the T1 that are adaptable to various contexts. And we've also been able to work collaboratively with the multidisciplinary teams across WHO and also together with partners from other institutions that deal with public health and also outbreak response. We've managed to design, or rather the outbreak toolkit is designed to support the frontliners or the field investigators at the front line to be able to quickly put together the resources and the protocols that are required for outbreak investigations. And then with the outbreak toolkit, we've managed to really prioritize the essential description and the analysis of and the interpretation of the epidemiological data. And it does not so much dwell on the research part. It might not be very helpful when it's research. But then we also focus on the utilization of this data for informed decision-making and reporting. Next. So up to date, we have a dedicated webpage called the WHO Outbreak Toolkit webpage. And so far we have 23 disease toolboxes. And in each particular disease toolbox, we have key reference documents and guidelines developed by WHO. We also have a section of already extracted case definitions so that you don't have to go through the guidelines also to, at the time when you're developing the case definition, to try and look at what the case definitions are. We've also put together all the resources that are required for laboratory sampling and testing methods of that particular disease. We also have other response tools that are required for either to support in control of the outbreak, to support in IPC. And we also have data collection tools that are already in Word, in PDF format, and some disease toolboxes also have XLS forms that are easily downloadable into any application that you can use to collect data, either COBO, Survey 1 to 3, and so forth. And we also have quite a number of other resources that we've categorized as other, that we think are relevant to each particular outbreak. For example, for monkeypox, we have quite a number of resources for public health advice. And recently, we've also added risk communication and community engagement resources also to help during the response. Next slide. So we also have standardized generic data collection tools, which are very original to the OTK because they were developed by a broader group of colleagues from different organizations. And one of them that we're really proud of is the initial generic case investigation form that was developed to sort of present the minimum core set of data variables that are required for outbreak investigations. And this particular questionnaire that we call the time zero questionnaire helps also come up with an hypothesis, especially when you don't know what outbreak you're dealing with, as well as come up with the initial control measures of that particular disease. And then we also have a very comprehensive questionnaire that we call the Time 1 questionnaire. And this is a questionnaire used to investigate outbreaks of unknown etiology. It's very comprehensive to an extent that we have about 462 variables in that particular questionnaire that we think can easily be contextualized in every outbreak setting, especially when it's already proven that to some extent we don't know what we are dealing with. And this questionnaire helps you really collect all the information that is required so that you do not overlook anything. Contains a lot of information on the clinical symptoms for every particular system. And it's precise in a way that you either have seen this particular symptom or you haven't. And just to make sure that you do not overlook anything, because the experience so far is that sometimes we call a disease unknown simply because we've overlooked some information or some data that we were supposed to have collected. And so we keep on going back and forth until we find exactly what is happening. Recently, we've also added a dedicated one page for One Health page at the Outbreak Toolkit. And this is to help those of us who respond to zoonotics and also those of us who want to carry out One Health coordination operations. And you can access all the resources there, as well as the risk communication and community engagement resources. Next. So what next for us? What you're asking of you colleagues, how to help us take this forward is to go and explore the Outbreak Toolkit, familiarize yourself with it and all the resources that are available. Adopt some of these tools in the field on a need basis. We also have these XLS case investigation forms that are already prepared and are also already usable. And we also ask you to share with your teams, especially the FATPs also, who do a lot of outbreak investigations, and provide feedback. We will include the email for Outbreak Toolkit email, so that we may receive feedback from you. And we also ask you to stay updated as we update all the materials that are also in the Outbreak Toolkit. Thank you so much for listening. Over to you, Mariam.
Thank you, Leshan. And with no further ado, we will move to Bernadette, who is also a field epidemiologist trained through an EPTP in Uganda. She has also worked with WHO for a very long while, especially on the Outbreak Toolkit and on rapid risk assessments for member state tools. And she is now currently in Uganda. Over to you, Bernadette.
Thank you very much, Mary-Emily. I hope you can hear me well. So I appreciate all the people who have joined this webinar, and I will share experience on how the Outbreak Toolkit can be used in an outbreak investigation. So outbreaks are spontaneous, and we often don't go to bed expecting that this outbreak is going to happen tomorrow. Even with models, we are still always uncertain. However, as epidemiologists, or as public health experts, we need to be informed when we are responding to any outbreak. As an epidemiologist, you need to be familiar with the outbreak investigation guidelines, and often they can change from the routine surveillance guidelines and tools for example, a disease like cholera. But we are humans, we often forget, and we are sometimes unsure on what the guidelines say or if there are any new guidelines that are out there. The WHO Outbreak Toolkit is a resource that can be used to reduce the hassle of flipping page after page, finding case definitions, quick facts about the disease, and also finding other tools and resources that can be used for outbreak investigation. Now, I won't dive into the details of the toolkit. However, I'll highlight how it can be useful based on my personal experience. When I was an FATP fellow, we were often deployed to investigate the same disease in different areas. For example, like one team would be deployed to investigate CCHF in District A in 2018, and then in another year, like 2019, CCHF would be detected, and a team is sent to investigate CCHF in District B. And even sometimes these outbreaks would be happening concurrently, however, in different locations. But at the end of it all, some of this data was never comparable. And we can know that in data, sometimes yes or no can be very different from yes, no, I don't know. And also it can affect the interpretation of the results. So the WOTK has a collection of disease-specific outbreak investigation forms that foster consistent data collection and yield comparable results. You have the same data collection forms, and these forms can also be used in different WHO member states. And their outbreaks can actually be comparable across borders and also in different contexts. As Leshan highlighted, that they are downloadable generic forms, the initial case investigation form T0 and case investigation form for outbreaks of unknown cause, which is T1. And I'll share with you an experience on how these forms would have come in handy had this toolkit been available at the time. So in 2018, we get deployed for a condition where all we knew was that children were peeing blood, hematuria just to be technical. And I come from Uganda. We often have very limited resources. We usually have a week or less to do epidemiological finding and have some kind of context on why the outbreak was happening. Now, we were tasked to have line lists and a possible hypothesis within a few days. Now, I wish we had a basic tool to use at that time because due to the data entering and analyzing, we had long days, long nights trying to capture this data on paper, and then would painstakingly have to enter all this data in Excel at night. So you can imagine how long our working hours were at the time. Now, the OTK has data collection forms that can actually be downloaded and uploaded within data collection tools such as ODK, Kobo Collect, and others. And as any field person, you would understand how it can be convenient to have some sort of tool to base on, but also to have a tool that can be uploaded into a digital data collection tool to ease data collection and also, generating of databases. Now, additionally, when I look at the form T0 and the form T1, these are great tools for preliminary outbreak investigations to help us describe who, what, where, when, and how. And in this scenario where we were deployed and knew very little, we had to generate our own. For example, the T1 is a very extensive tool that examines various case characteristics and exposures, including water, food, travel history, exposure to animals and insects, and so on. And this would be an excellent tool that we would have used in this scenario because we knew so little about what was happening to these children and what was causing them to be so sick. They would have been easily a great start to our outbreak investigation. Now, I would like to conclude that the WHO toolkit is not a new tool. It's not one new tool that needs to be used. However, let's look at it as a model for epidemiologists and other public health experts. You have this one place where you'll find guidance on how to conduct outbreak investigation. And in there, you will find different disease-specific investigation tools and resources, and tools that are downloadable, adaptable, because some of them are in Word, and they can ease outbreak investigation. I therefore encourage all of you who have joined this webinar to familiarize yourself with the toolkit and also utilize it in further investigation within your work. Thank you for your audience, and I pass it back to you, Marie-Emily. Thanks.
Thank you so much, Bernadette. Really point on with your conclusion. Thank you so much for sharing your experience. Now we'll turn over to Aspen. She's a technical officer with the Global Influenza Program in the Global Respiratory Threats Unit in the Health Emergency Preparedness and Response Division. She works on the seasonal and zoonotic influenza surveillance, and she'll be presenting on joint outbreak investigation during avian influenza outbreaks. Over to you, Aspen.
Thanks, Marie-Emily, and thanks so much for the invitation to participate in your webinar. I am going to speak briefly on the current EPI situation, talk a little bit about surveillance and investigations and tools, because there is a specific page for this on the Outbreak Toolkit page. So influenza viruses are commonly detected in birds and more recently some mammals. And there can be subsequent transmission to humans, resulting in infection in human cases of infection with zoonotic influenza. So here we can see the epidemic curve that shows the human cases that are reported to WHO over the past few years. So there's a lot of different colors, and these colors represent different influenza subtypes that have infected humans. So these are different from the routine seasonal influenza viruses. These are animal influenza viruses that infect humans. Probably you're familiar with H5, H5N1, but there are many other subtypes that can infect humans. It's important to note that most human infections result from direct or indirect exposure to either infected animals or environments that are contaminated by infected animals with their droppings. Infections can be severe and fatal, although some mild cases are reported. And it's also important to say that at this point, there's no known sustained human-to-human transmission. So these cases, again, result from exposure to animals. But it's important that rapid, prompt, and thorough investigations around human cases are done. This is really critical for many reasons, but for global public health, really to look for unusual events that might signal changes in transmission, suggesting any person-to-person transmission of these viruses. Next slide. So again, as I said, it's really important to detect early any human cases of zoonotic influenza. For several reasons. Number one, to provide human cases with the appropriate clinical management to optimize their care and outcome. It's also really critical for us at the global level to understand epidemiology, who's at risk for infection and severe disease, and where and why. We also need to understand the viruses and how the viruses are changing. And again, if there's any change in transmission, suggesting that the virus might be spreading from one person to another. And so it's important to respond and control to outbreaks or any suspected or confirmed human cases so that we can try to prevent further spread among animals, but also from animals to people and prevent further human cases. We're also particularly concerned because of the pandemic potential of some of these viruses. So it's really important to stay on top of these kind of outbreaks or events. Next slide. So as I said, early detection and surveillance is essential. Human infections can be severe, so we need to make sure cases get appropriate care. And we know that no single influenza surveillance system can really achieve all the surveillance objectives, including around early detection. So it's really important to have a mosaic, so a variety of different surveillance systems to try to make sure that early detection for zoonotic influenza can be achieved. And so this might include event-based surveillance, other types of community surveillance. We also have our routine healthcare facility-based surveillance. But monitoring for outbreaks and contact tracing is also really important. We do have international health regulations that support the building of capacity for this. And it's really important that we work with our animal health partners as well. So we want, again, to detect early cases of human infections and assess for any changes in transmissibility and severity. Next slide. So in this line, we have guidance for investigating. So we say non-seasonal influenza, which would include zoonotic influenza or other acute respiratory diseases. So this is just showing the guidance that we have on investigations. It's a protocol, it's very detailed, and it also has a lot of tools and templates that can be used if you need such things in situations where you have a respiratory outbreak and possibly zoonotic influenza is suspected. This can really guide you through different steps of the investigation. And this is all, this information, this guidance is linked on the Outbreak Toolkit, as well as some extracts from this guidance in the form of tools and templates are available on the Outbreak Toolkit site. Next slide. And I also wanted to mention that we just fairly recently published a outbreak template for zoonotic influenza using the GoData template. So if you're familiar, if you've used GoData for other outbreaks, we've now developed one that's very much in line with the outbreak guidance I just showed. This is a standard template which includes a lot of the fields and questions that are essential for these kind of outbreaks. So that's available now, and we look forward to any feedback or experience that you might have if you need to use that. Next slide. So in addition to outbreak investigations, sometimes other studies or early investigations can be critical to meet other objectives and answer important questions like how severe are infections, who's at risk, and what are the risk factors, and potentially how are household members affected if there's any suspicion of transmission between persons. So for answering some of these questions, WHO has readily available protocols under the umbrella of the Unity studies. And you might be familiar, these were quite widely used during the COVID-19 pandemic. But in the next slide, you can see, sorry, just move to the next one. Thanks. There are protocols specifically for respiratory investigations and studies, some for generic respiratory pathogens, but there are also some specifically for influenza. So these studies are, for example, looking at the first few cases and contacts, looking at household transmission, and there are some that are in development and hopefully should be available soon, such as rapidly assessing clinical severity and doing, again, looking at a case series investigation. So a lot of these are available on our websites that I've linked here, and we are working to further develop tools to support these studies using GoData software and make them available on the Outbreak Toolkit site. Next slide, and last, I just wanted to conclude by acknowledging that for influenza surveillance and monitoring, including animal and zoonotic influenza, we have a global network called the Global Influenza Surveillance and Response System that's been around for over 70 years. And this is really the cornerstone for global influenza surveillance and monitoring. It comprises 160 institutions globally, laboratory institutions and specialized laboratories. And it's really key in providing updated guidance and building capacity in countries around the world to detect influenza. And again, the importance, I don't think, can be emphasized enough about our collaboration at the global level with our animal health partners like FAO and the World Organization for Animal Health in working on early detection and outbreak investigation in the One Health approach. So last slide, just to thank you and appreciate your attention, and we'll remain again here for any questions. Thanks, over to you.
Thank you so much, Aspen. There were some questions, I think, mostly in the chat, but so hopefully they'll be back in the Q&A. And you have a couple of questions also, you can see in the Q&A whether you want to reply to them or not. Now we're going to turn to AIM. AIM is a technical officer. She works in the capacity assessment, planning and readiness units in the Health Emergency Preparedness Department in the same division. That unit specifically works on the international health regulations, monitoring and evaluation framework, and the National Action Plan for Health Security with the One Health approach. So AIM will be presenting on the response preparedness program in the context of One Health and how the outbreak toolkit can support this work. Over to you, AIM.
Thank you, and thank you for the introduction, and thank you for including me in this program. So we all have heard about the Outbreak Toolkit and its application in country, as well as an example on a disease. So now I'm going to talk about Response Preparedness Program. In short, we call REPREP, and just to bring in the preparedness aspect as well as the One Health perspective a little more broadly. So I will be talking about the program in the relation of the Outbreak Toolkit, its objective, and the outputs of the program, and also different components of the program itself. And I'll end with the resources that you can go find more details and our contact information. So generally, you will visit the Outbreak Toolkit that Lishan has mentioned, and there is also One Health page, as he also mentioned, and RepRep is listed under the One Health resources page. But generally, most of the time, people will visit this to look for information, to look for resources when something is already detected. So, or either is unknown or a zoonotic disease agent, but to be more effective in using this information, whether it's disease specific or more generic information, looking at the guidance, how to develop the case definition, the guidance on the lab diagnostics or other response resources more effectively, it would be helpful for the country or at a subnational level, at a local level, to have the joint framework or structure for a coordinated response. So you know what the structure you have, the different people in different agencies, how you work together, so that when you have an outbreak, when you detected something, either unknown zoonotic disease, you can come to the resources and use them more effectively. And why do we need this framework? Because generally, when there is an outbreak, when you detect something, you need to collaborate with people across different levels, whether it's at the national level, subnational level, operational level, and also across sectors, fundamentally animal health, human health sectors. And you also have other sectors in between, whether it's disaster management, law enforcement, or social scientists who you work together. And you can look on the screen. There are so many arrows going different ways. So it would be helpful if we are a little more organized, working together. And we can work together in different work streams, or we can call pillars. It could be epidemiology, as Bernadette has mentioned, this outbreak toolkit is really helpful for epidemiologists, but there are other areas as well. For example, lab diagnostics, communications in other areas, resource mobilization. So if we are more organized before an outbreak happens or before something is detected, we would be more successful in responding to that. So how um, does the RepPrep program do it? So it would help countries, it would help you to define who should do what, who could mean different agencies and also people working for those agencies and the structure, how you work together. And then you come to define different roles and responsibilities within the structure, basically so that you know exactly who would do what when something happens. And all of that together, you put into developing an operational framework, how you all work together. And there are three components of the RepPrep program. That's why it's called a program, not just a workshop. So you start with an online introduction or online training, and then you come together in a face-to-face workshop, and then there's a post-workshop phase as well. So this is an online videos that we have developed, and I have to mention that all of the materials have been developed in collaboration with the Food and Agriculture Organization of the United Nations and also the World Organization for Animal Health. So you have the link to access these videos at the bottom of the screen. So all of these videos combined collectively just last about 1 hour long. So you can do 4 of them in one go, or you can do them separately. So once you've gone through these videos, ultimately you come together in a workshop. I mean different sectors, ideally animal health, human health, and you can also bring in other sectors, law enforcement, disaster management, or social science as well. You review current national zoonotic disease plans together, go through the disease scenario, a fictional one, and then discuss to come up with a draft of a coordinated response framework. And what does a coordinated response framework look like? So this is just one example. As I mentioned, that you organize in different work streams or pillars for the coordination, and in this screen as well. So for example, surveillance, epidemiology, disease control, case management, logistics and safety. So basically during a workshop, each work stream or each pillar you discussed, what would be the roles and responsibility of that particular pillar, whom you would like to involve in that pillar, and how you work together. And then you discussed, and then you translate it into a document outlining the TOR or responsibilities and roles, mandate, composition. And you discuss for different work stream or pillars, and then you have an operational framework. So at the end of the workshop, you ultimately have a draft operational framework that you can consult and finalize after the workshop. And you don't end there because you would like to put it in action. You would implement that framework and then test it and redefine it. So that's basically a whole program, rep prep in a nutshell, very quickly. So here I'll uh, end with the resources that we have that you can find out further about rep prep. And also rep prep is part of other bigger One Health operational tools as well. So you can explore more with this link. And if you would like to get in touch, I have an email there. So thank you very much. I'll turn it back to Maria Amelie. Thank you.
Thank you so much, Aim. We've had many questions in the Q&A on the OTK, but also on influenza. So maybe we'll start by answering some of those questions about the OTK. A lot have already been responded to, but I think one topic that is really overarching topic and something that we really need to make clear about the toolkit is I see some questions about, do you deploy the toolkit? How can we use the toolkit? Is the toolkit aligned with other frameworks, etc.? So maybe I'll turn to you, Leshan, on what is, we call it a toolkit, but it might be misleading for some. So maybe reminding everyone of exactly what the toolkit is in terms of being a repository of resources. Over to you, Leshan.
Thank you, Maria Amelie. So we completely understand that the word tool itself is sometimes quite confusing. But the idea or the simplest way to look at the Outbreak Toolkit is what I mentioned earlier, as a one-stop shop to be able to access all the materials and resources that are required to respond to that particular outbreaks. We mentioned initially that sometimes we take a lot of time putting together the resources, the protocols, the data collection tools for investigating these outbreaks. And so what we've provided is a store for you, a shop for you to pick up all the materials that you need for outbreak investigation of cholera, for example. And then we don't necessarily collect or receive any data ourselves. We've provided the materials for you to be able to contextualize into your particular context in any outbreak, and then you'll be able to use them to investigate the outbreak. So it's not a tool per se that we use to collect data in itself, but it will provide information and resources to help with the collection of that data. Thanks. Sorry, we can't hear you, Maria Amelie, you're on mute.
Thank you, Leshan. This also, I guess, answers the question around how it can support and integrate with other frameworks, such as the 717 framework. I'll turn to Aspen. There's a question on the spike of influenza 2025 and countries being at risk, etc. So are there other similar questions? I'll turn to you for this.
Sure, thanks. Yeah, I see there were a couple questions, and thank you for noticing there was quite an increase of H5N1 human cases, especially at the end of 2024 and also continuing into 2025. So at the end of 2024, there were quite a number of human cases of H5 infection that were notified to WHO, particularly from the United States. And this follows an outbreak of H5N1 that was detected in dairy cattle in that country. So there were quite a few dairy workers who had direct exposure to infected dairy cows, and subsequently tested positive. Luckily, their illness, the majority of those cases, was quite mild. In addition, I would say that a lot of the increase in cases as well over the past year or so, there have been human cases of H5N1 detected, reported from Cambodia as well. So I would say that those cases represent quite a good proportion of the recent cases you see in the curve there. So I hope that answers that. And maybe I just take the opportunity just to add on what LaShawn said. So on the outbreak toolkit site for zoonotic and avian influenza, again, it's not a tool itself, but it really, I think, is a really helpful resource to bring together different resources that are available, because you may be tasked with doing an outbreak for a respiratory, and it may be difficult to find some of those resources amongst the many web pages of WHO. But I think that the advantage is that those are all brought together on the outbreak toolkit site. So I know from my side, I work hard to make sure that we have everything there and that it's up to date. But it is a really good resource that brings all those together. Thanks.
Thank you so much, Aspen. I'll turn to you, Aim. There's a question on how the RIPRIP program aligned with the IHR PBS National Bridging Workshop.
Yes, thank you. So if I may, I would like to answer another question as well on RepRep, but I will start with this question: how does it align with the IHR PBS National Bridging Workshop? So basically, I think you can look at how to strengthen the collaborations of different sectors different ways. So if you start at the IHR PBS National Bridging Workshop, you look at all of the areas that at least two sectors, human health and animal health sectors, collaborate. And then you look at which areas is green, yellow, or red. Green is like, good job, we are collaborating really well in these areas. For example, lab diagnostics, but then you might have a rate, or almost rate, in the coordinated response or coordinated surveillance. So when you use the IHR PBS National Bridging Workshop to identify areas that you need to collaborate, and one could include the coordinated response, then you could continue to use the RepRep program to strengthen a specific area of collaboration. Yep. And I would like to answer another question on RepRep as well. How does it link to the skill sets of those people in the structure? So because RepRep, once you finish using this program or going through the whole program, you have a structure or a framework, how different agencies, different sectors work together in a coordinated investigation and response. And we also have another tool called Workforce Development Operational Tool that actually look at competencies and basically the skill sets that you are asking for different positions within that framework. So we cannot fit everything in, just one program. So first, you might like to think about the framework that you would like to have, the people within the structure that you would like to have, and then after that, you think about developing them. And we have another set of tools looking at the competencies of those people. Thank you. And the link that I provided at the end of the slide can also take you to that workforce development operation tool as well. Thank you.
Thank you so much, Aim. I think given we're so lucky to have all of you on this panel with really this One Health approach, and Leshan for the toolkit. We also have Stacey online, who put together the One Health competency for field epidemiology framework. So we have this question from Mahmoud Hassan about, is there any sector-specific One Health toolkit to investigate zoonotic diseases? So I'll start answering. For now, the short answer is no, but there might be some work in progress or things that might be in development or not. Maybe I can turn to I don't know, someone on the, I'll turn to Stacy because you know everyone by heart in the One Health world, and you will give the floor to the right person. Over to you, Stacy.
Thanks, Marie-Amélie. I don't think that's possible, but that's really nice. So thank you for your question. I think you're looking for sector-specific information about outbreaks or sector-specific guidance. I think there are such things available for specific sectors, including, of course, public health, but also for animal health. What we are trying to do is actually develop additional resources for coordinating responses with between human, animal, and environment sectors during zoonotic disease outbreaks. So Marie-Amélie just mentioned the coffee framework, which we developed to support field epidemiology training programs. COFFEE stands for the Competencies for One Health Field Epidemiology, and it's a resource that identifies the knowledge, skills, and competencies that are needed for One Health outbreak investigations and surveillance, all of the things that FETPs do. But it also specifies sector-specific knowledge, skills, and competencies that are needed as well. So this is a resource that you could look at. And we want to continue to develop guidance in this area, and we hope to do so soon. Thank you.
Thank you, Stacy. Thank you so much. I think that's it in terms of questions, and let's still go through. There were questions about translations of the toolkit being available. Those are not, and Stacy did answer to those, but we had several questions about that. Most of the resources are not developed by us. They are actually resources that have been developed by other WHO technical teams, and now with the One Health page by other organizations contributing to One Health, especially FAO and WOA. So where they're available in the language they are made available, we don't translate them. However, some case investigation forms have been translated into French, Spanish, and Arabic, and are made available as soon as they are on the website. Maybe I'll turn back to you, Supriya, for the last Slido part question. And I want to thank you, all the panelists, for coming today. It's really great to have been able to put all of you together to present today. Over to you, Supriya. We can't hear you, Supriya.
Thank you so much to everyone for an excellent webinar, and huge thanks to the speakers and participants. But participants, you're not off the hook yet. We would like to hear a little bit from you with the next Slido. As I said, now you've learned all about the WHO Outbreak Toolkit. Tell us more. Before today, how familiar were you with the WHO Outbreak Toolkit? So you have three options: heard about it but haven't used it, not familiar at all, or very familiar. And as usual, go to slido.com, hashtag 3046766, or scan the QR code on the screen. I hope you can all see the screen clearly. Yeah. You've heard about it. So 55% so far have heard about it but haven't used it. But come on, we'd like more of you to respond, please. There are some 700 of you out there, and we only have 118 responses, climbing now a little bit, but we'd love to know more from you. Yeah? So, yeah, most of you have heard about it but haven't used it. And well, a good chunk of you, 35% so far, are not familiar at all. So that's great. Thank you in that case for joining. I hope now that you're familiar with it, you can use it. You can share with colleagues who will use it, and it will be useful. Uh, okay. A few more of you. We'd love to hear from more of you, please. Okay, we go on now to the next question. This is open, by the way. I'll leave this open for the next 1 hour so that you can still think it. Which part of the outbreak toolkit do you find the most relevant to your work? Okay. Uh, Now, as you can imagine, this question is response from you to this question is very, very important for our panelists and speakers here because they would like to know, you know, the whole point of the outbreak toolkit is that it should be relevant and useful to your work, and which is most useful is very good to know. And any of the panelists, if you have anything to say as well, please do say so.
We would also like when you receive when you go on the EPI-WIN website to see the presentations and maybe the recording also, we'll definitely also communicate the email address of the Outbreak Toolkit team. We really would love for all of you to, for those of you who are involved in outbreak investigation and who might use the Outbreak Toolkit, we would love to get your feedback because this is really something that aims to be hands-on, used, and done to make your life easier when you're investigating an outbreak. We are looking to add on some resources around analytics. We also will also working with the regional offices, so that we can also make sure that those diseases that are more regionally or their context is more regional, and more specific to certain regions, have the right languages represented, and also the right regional recommendations represented. So all of any kind of feedback would really be welcome. Any things that you might be working on would really be welcome. We also want to digitalize more and more of the case investigation forms that are made available. All of this requires some resources and takes some time, but if you have anything that you feel strongly about is what should be a priority, please do reach out and do send us an email. Thank you so much.
Thank you, Marie-Amélie. Just to repeat what she said, she would really appreciate any feedback you might have. And you can find that on our website, of course, but you can also, if you write to epi-win@who.int, we will forward anything that you might have to say to Marie-Amélie and her team. So it looks like the most important part for you is outbreak investigation guidance documents, followed by investigation and data collection forms, and then the rest. So I will stop sharing this here to let you know to share yet another um, uh, form, which is what we have upcoming. So next week we have 2 EPI-WIN webinars. So the first is can you see my screen? For some reason, it's not showing, but let me just try again. So on Monday, not the regular Wednesday, but on Monday, we are partnering with IPSN to host the EPI-WIN webinar on attributes of pathogen genomic data platforms supporting timely and equitable sharing. This is a document that's been published and would be launched. It's about how to have equitable and timely sharing of genomic data and what you can do. This followed by on Wednesday, we have another EPI-WIN webinar, and that will be on meningococcal disease. So I am sharing the links are also on the chat. Maria Isabella has shared that on the chat, but I am also sharing it here. And if you're a subscriber to EPI-WIN, you will have received it also. So on Wednesday, next Wednesday, we will be launching the document defining cases of meningococcal disease, a public health tool for outbreak prevention and control. That will once again showcase how you can use this new document for your work. So, and there are more webinars coming up in December, so watch this space. You will be getting the email, and we will also share with you at the end of December a survey to know more about what you want, what you liked about EPI-WIN, what you didn't like about EPI-WIN, and ideas about what you want to hear more from us. And with that, thank you once again. A huge thanks to Marie-Amélie, Leshan, Bernadette, Aspen, Aim. I hope I haven't missed anyone. And of course, Stacy and Nikki as well in the background. A huge thanks to all the participants and to everyone who's worked in the background here. Kanika from Project Echo, Michael, Lester, and Maria Isabella from the EPI-WIN team. And I hope you have a great day ahead. Thank you so much. Bye.
Thank you.
Thank you.